Children's, and I'm embedded in our Center for Cancer and Blood Disorders. And I just want to say thank you for having me today. I'm so excited to be here. The most important thing to me are our patients and our families, and I'm happy to talk about this. I feel like it's a good segue because we can return back to pediatrics and I can say, look at all this great data we've got and what we need to do about it. So today I'm going to talk about neurocognitive functioning in our kids and teenagers and young adults with sickle cell disease. So I'll talk a little bit about what we know about neurocognitive functioning, why we see these changes in cognitive skills, how do we assess cognitive functioning. I often introduce myself as a neuropsychologist and then have to explain what a neuropsychologist is, so I'll do that today. And then what can we do to support cognitive development? If we know about these risk factors, are there things that we can be doing to help support our brain health? All right, so what do we know? So in general, when we look at large data studies, the overall IQ scores of patients with sickle cell disease tend to be lower than either their siblings. So when they do studies and they compare them to their siblings' data, or their peers who are demographically matched, meaning they live in the same area, they come from the same kinds of backgrounds. And on average, this isn't a huge difference. It's about a 4 to 5 point difference in IQ scores. But depending on what neurologic complications there have been that we've been talking about this morning, that difference could be slightly larger. And what we find is that that difference can increase across the lifespan. So we might see it a smaller difference when kids are younger, but we see that difference start to increase, especially as our patients are in adolescence and young adulthood. So there are certain cognitive functions or thinking skills that we think are the most affected, and I think this has been talked about a little bit in terms of attention, our ability to focus or concentrate, our executive functioning skills, and that's a term that describes lots of different, these are like the how-to skills. Like, how do you take your knowledge and show it and demonstrate it in the world? How do you plan things and stay organized and do things quickly, hold on to things in your mind, in your working memory, and be able to act in the world? We also tend to worry about speed. So that's a common thing that comes up in a lot of the evaluations that I do, that things just take longer for our kids and teenagers to do. And there can be weaknesses in language and verbal reasoning, especially if there are any concerns about, it's a common area for some of those strokes or silent infarcts to occur. We also know that there can be weaknesses in academic skills, and these are not just fully based on what has happened in a brain, but also, you know, there's a component of this in terms of like what school districts are you in, what school resources do you have, and those kinds of things. But when we look at the data, kids and teenagers with sickle cell disease tend to score lower on tests of reading and writing and math. And also their adaptive skills can be lower than their same age peers. And adaptive skills are daily living skills. Can you take care of yourself? Can you organize your self-care? Can you go out into the community and know how to interact in the community? Those kinds of skills. So why do we see these differences? Why does this happen? We've been talking a lot this morning about some of the direct impacts and how sickle cell disease and aspects of that can impact the brain. There's less obvious medical issues that can affect brain function. And then there's psychosocial factors that we think about that can affect anyone's brain function. Any one of us can have issues related to accessing effective education. My colleague just before me started the discussion about mental health, and we know that the toll that mental health can take on our brain health and our cognitive functioning, and also any kind of socioeconomic factors. So this has been talked about a lot today, so I'm not going to go into this in detail, but if we have a stroke, and ischemic strokes are the most common in children, that we worry about that. Because where that stroke happens can change what thinking skills we see having a bigger impact. So for example, if you have a stroke in that left hemisphere where those primary language centers are, that can impact your ability to understand language, to be able to express yourself. So when a child or a teenager has had a stroke, we really want to do an evaluation and make sure we look at where that stroke happened and what skills are we worried about for that. The silent cerebral infarcts that we've been talking about this morning also can impact our thinking skills, and we've been talking about how frequently these can occur and that you can see them on MRIs even if you've had no symptoms. And these tend to happen in parts of the brain where it might not be, you might not see that direct impact, but it might be more subtle changes in cognitive functioning. And again, when these things are happening, that's something that can even further impact cognitive functioning and cause even more declines as compared to peers or siblings. All of these are, so we've had studies that can correlate all of these kinds of aspects of the disease to cognitive functioning. When I think about a brain, this is sort of a simplified version, but our brains are kind of sensitive and they really like oxygen and they really like the right amount of oxygen and they don't like it when they're not getting oxygen. They tend to be pretty picky about that. And so any of these things that can cause challenges to that oxygen flow to the brain can impact cognitive functioning. And it can be a temporary issue, right? So, when I see our patients in the hospital and they're in the middle of a pain crisis, they're not at their best. And sometimes their thinking skills are not at their best. We can see that they just can't make the same decision making or do the same advocacy that they do for themselves when they're in the middle of a pain crisis. But if we have any sleep issues, if you're not getting enough sleep, or if you have any kind of sleep conditions, that can impact, for anyone, but especially our patients with sickle cell disease, that can impact cognitive functioning. We were talking a little bit earlier about changes in vision. Well, you need to be able to see, if you're in school, you need to be able to see what the teachers are showing you and see your educational materials to then be able to take that information and learn. So all of these other aspects to the disease can also impact our thinking skills. And then, as I said, these psychosocial factors are things that impact any one of our brain functions. So whenever they study any kind of medical condition, including sickle cell disease, we know that there are certain factors that do tend to correlate or are associated with either weaker cognitive functioning or weaker thinking skills or stronger cognitive functioning. So if, depending on what the family income and the parent education looks like, that can have a correlation to what the cognitive functioning, overall cognitive functioning is for a patient. What their early childhood environment was like. Did they have access to early childhood education? Were we able to eliminate any kind of trauma experiences that can impact brain development? Throughout the childhood and adolescence, do they have access to education and to the actual education supports and services that they need? And are there any mental health issues? Because these mental health issues like anxiety and depression can themselves have an impact on brain function. So one of the examples I always use is if I see one of our teenagers and they're experiencing some significant depression, well, if they have a weakness in processing speed, they can be even slower because depression has been known to slow down the way our brains work. One of the core symptoms of depression is difficulty focusing. So if you already have an attention weakness and then we add on depression and our attention system is even weaker now, that's going to make it much harder when you're in school or you're at work and you're trying to focus. And I always, we think about the things that are very specific to our patients with sickle cell disease, and one of those is the missed school aspect, right? And we don't have, our school systems aren't designed to manage the intermittent or the missed school every once in a while, right? If you miss school for a long period of time, we have these other things that kick in. But if our kids are missing school every once in a while, they might miss a few days, then they just sort of go back into school and they might have missed something that's important, but we don't have a good way of catching them up. And do they have access to the appropriate services that are specifically tailored to the risks of sickle cell, right? So maybe they do have access to the nurse as much as they need to, but are we aware of all those cognitive risk factors, and are we doing everything that we need to do to make sure that they have access to all of those educational services and supports that they need? All right, so how do we assess neurocognitive functioning? How do we find out if these things are happening? So you meet a neuropsychologist, and at Connecticut Children's, we're lucky that I'm embedded in hematology and oncology, so I'm part of the team. A neuropsychologist is, usually we're clinical psychologists, we have doctoral degrees, sometimes it might be a doctoral degree in another field of psychology, and then we have extra training to really focus on neuropsychology. We're really focused on brains. How do brains grow and develop? What do we know about sort of typical brain growth and typical development? And what do we know about medical conditions or life experiences that can impact that brain growth and impact those thinking skills? For a comprehensive neuropsychological evaluation, it usually starts with an interview because I want to get all of the history, right? We have access to the medical records and all those kinds of things, but are there things that run in the family? Because there can be learning issues or other kinds of struggles that run in the family. Were there any complications during pregnancy or childbirth? Because those can impact brain development. What kinds of services does the child or adolescent have now? What have they needed in the past? Are there other things that you have concerned about? Are there any other medical conditions that we need to be thinking about? And once we get all of that information, we plan for the actual testing, which occurs in 1 to 2 assessment sessions. So it sort of depends on who the neuropsychologist is, how they like to do things, and whether we're adding on some of that academic testing, looking at like reading and writing and math. I like to do 2 sessions because I like to look at everything. In the adult world, they do tend to be just 1 session. But we're going to look at lots of different thinking skills. So we will get that IQ score and do a full IQ test, in part because if I want the school to do anything, I have to have all of that data, but also because that IQ test actually gives me a lot of information about lots of different thinking skills. So we're going to look at your language skills and verbal reasoning, your visual spatial skills, attention, executive functioning, memory, fine motor skills, because those can be a weakness. And like I talked about, those academic skills, so that reading, writing, and math. But this is a whole child or teenager or young adult in front of me. So we are going to also look at emotional and behavioral adjustment, because if there are any mental health issues or behavioral concerns, that can impact how they're doing day to day. What do those adaptive skills look like? Is there anywhere there that we need to intervene? If there's concerns about social skills, and our kids and teenagers interact in lots of different parts of their lives with different systems. So are there other people that we need to talk to? Are there other records that we need to be reviewing? For me, I'm lucky I'm on this medical team. Like, I go right to our nurses because they know the information that I need to know. And then the last appointment is the feedback appointment. And to me, this is the most important appointment of the evaluation, because this is where we go over the results and we make sure that our patients and their families understand everything, where I provide any recommendations that I might have, I answer any questions that they have. I can't really require all the teenagers that I assess to come to these appointments, because we need to teach them how to advocate for themselves and they need to know this information. But if I had one recently, a 7-year-old wanted to come, and so we started the feedback meeting with information tailored to that developmental level, and then they wandered away. It was a telehealth. I love telehealth for this reason. They wandered away and went to play, and then their parents were able to ask all the questions that they had. And what we're thinking about, what would those recommendations look like? It depends on what results we get, right? What are the results of the assessment? What do I know about what kids and teenagers are at risk for who have sickle cell disease? Where are they in their development right now, and what's coming next? I feel like this is really where we can be really helpful. Like, if I do an evaluation and this student is in 5th grade and I see that there's some of those executive functioning weaknesses or there's some memory weaknesses, I can say, okay, here's what that's going to look like when you transition to middle school. Now we have multiple teachers, multiple demands, those kinds of things, or in that transition period into high school or adulthood. So this leads nicely into, when do I think about doing these evaluations? In an ideal world, I do it at all these time points. We know that that's not always, we're not always able to do that, but I think we have really great data now that's showing that sometimes we can see some of these weaknesses in that preschool range, right? For ages 4 and 5, before they're headed into school. And if we catch it then, we can do a lot of proactive preventative work to make sure we've got all the services in place. That transition period, usually around 3rd grade, and I can feel it because I have a 3rd grader at home right now. 3rd grade, those expectations at school really start to intensify. And this is also a period of time in school where we're moving from learning the basics, like learning how to read, learning how to add and subtract, to using those basic skills to now learn other skills. I was talking before about that transition into middle school because there's increased expectations there, the transition into high school, and importantly, the transition into adulthood. Like, I would love to get everybody in our transition program to get an evaluation before they go. And I'm sure all of our adult providers would really love it if they came to the adult clinic with one of these evaluations fresh in hand. The reason why I think this is really important in that adulthood period, so I work in pediatrics, but we want to set people up for success. And I think it's really critical because if there are any weaknesses that are there, we want to know those, right? If there's weaknesses in those cognitive thinking skills, if there's weaknesses in those adaptive skills, we need to know that because these are young adults where we're expecting them to do more than their same age peers, right? We're transitioning them to the adult world and adult life, like college and work and those kinds of things. And we're also asking them, okay, now it's your turn. Like when you were little, your parents managed your disease. They took you to your appointments, they asked all the questions, but now you have to manage it. And so you're trying to manage a complex chronic medical condition with these cognitive weaknesses. And then we're going to transition you to the adult care world, which just doesn't operate in the same way that our pediatric world does. And so, and for a lot of our patients, right, they grew up in our clinics and they don't want to transition anyways. And now we're putting them in this world where it's harder and they have to advocate more and navigate more things. So that's a really important time point for me. And I love how my colleague who went before me is just nodding away here. This is really helpful. I just want one quick slide on the difference between what I do and what a school or a psychoeducational evaluation is. The main difference is that because there's a lot of tests that we give that actually are the same. Like I will give the same IQ test or the same language test as what a school might do. But it's what we do with that data, right? So when I'm doing an evaluation, I have a child or a teenager in front of me and I'm thinking about what is this child's strengths and weaknesses? What does their profile, their thinking skill profile look like? And how do we integrate that into what we know about their medical history? Whereas the school evaluation, they're really trying to answer a yes or no question, right? Does this child qualify for special education or not? And if they do, then they'll take that data to make those goals, but they're not really trying to integrate all of that. They may not have, many students who have sickle cell disease in their school, and they may not know anything about these risk factors, right? There are specific thinking skills or domains of cognitive functioning that I look at that are really important to these patients that schools don't always do also. I think that's an important point to highlight, right? I really hone in on those attention, memory, executive functioning skills, and schools aren't always looking at those skills in detail. If there are diagnoses to be made, we can make those diagnoses that can help access more services. And as I pointed out a few slides ago, yes, I'm interested in cognitive functioning, but this is a whole child or whole adolescent in front of me. So we also can make recommendations about what you might need socially or emotionally, or are there adaptive skills that we really need to target because I'm thinking about this young adult at some point having to manage their health condition in the adult health world. All right, so what can we do to support cognitive development? Well, I always say, no matter who I'm talking to about what medical condition, we take care of the basics, right? Are we getting enough sleep? So I don't know about you guys, but if I'm not getting enough sleep, my brain does not function very well. So are we getting enough sleep? Are we getting the good, healthy nutrition in to give our brain the fuel that it needs? Are we getting enough physical activity, right? There's actually, I don't work in the adult and dementia side of things, but my friends who do, there's amazing data that suggests that physical activity alone can prevent dementia. So are we moving? And are we doing physical activity in the context of knowing that we have sickle cell disease and there might be times that we can't do that, or there might be certain kinds of activity that cause pain crises and certain kinds of activity that actually make us feel better? Are we staying hydrated? How many times are hematologists saying, make sure you're drinking your water, right? But this is important for all of us. It's not just our patients with sickle cell disease. I will, give a plug for following the medical advice of your hematologist, and especially, I know hydroxyurea has been plugged a few times today, but we actually have some newer research that shows that if patients are on that and they're taking that, that actually protects that brain health and protects you from some of those cognitive changes. Are we accessing appropriate educational supports? And this is where the whole team, right, our social workers and psychologists and those folks can make sure that that 504 plan or that IEP is actually tailored to the things that student needs. And to monitor mental health, this is really important, right? Because if we're not aware of those issues and treating those issues, that can impact not just your brain health and your cognitive functioning, but your ability to attend school or be available to work and all of those kinds of things. All right, so are we doing questions and answers now? All right, thank you.
you, everyone. Thank you. Wherever you want. I think as long as y'all are loud enough. Is this hello? Oh, wrong mic. Yeah, because everyone is here. Yeah. All right, so you guys, we're taking a break now, but we're gonna also have our Q&A. So if you want, get food, snacks. If you submit a question, you can just, stay in the room, have it answered. You can raise your hand if you want to. And then all of our speakers, if you could just stay and be available to answer the questions. And again, at the celebration, you'll be able to mingle and talk to us individually.
Thank you.
Yeah, right up there. Was there a microphone? Oh, thank you. Thank you.
Should I start? Hi, good morning. Thank you so much to all the speakers that spoke so well. I'm so glad I came in today just to learn more. The two things, I've always kind of known a lot about sickle cell, not only as a parent, but as a clinician. The two things that I just learned is that I can actually advocate for an MRI, which I did not know that. Because we've been doing, our son is 10 years old, and we've been doing the transcranial Dopplers for the past 10, since I think we were able to, like 2 years old or whatever the age they recommended. And so, but I didn't know we can ask for an MRI at a school age. Would that be covered by insurance, or has there been issues with that being covered by insurance? That's the first question. So about the MRIs. The second one I had was about the neurocognitive testing. Is that a testing that we advocate for just without seeing symptoms? Because by God's grace right now, my son has been doing well on all his standardized tests. So I just want to know, is that something I advocate for even though he's doing well and I haven't seen any deficits? Or is this something we have to wait until we see deficits for? So that's my second question. And then the last question I had, was regards to the MRI, and I think you alluded to this, Dr. Assar, about how often do you do it? And so, I guess with my son being 10, will insurance cover it, even though the transcranial Dopplers have all been negative thus far? Thank you.
Do you want me to go? Do you want me? I can go first about the neurocognitive testing, and then you can talk about MRIs. I always think it's a good idea to just get one. So your son is 10. So the thing that I'm thinking about is like he's going to go to middle school at some point in the very near future, right? And he could be doing just fine, and maybe there's nothing. And that's a fun feedback meeting when I'm like, hey, everything looks great. Like there isn't anything. But I think it's worthwhile to think about that in that transition to middle school at some point. And that these are covered by insurance. And I don't know, we have a psychology retreat on Monday and they're talking about our denials, but we don't get very many actually as a group, is the data I heard ahead of time. So it is something that's covered by insurance because of the medical condition and because of the things that we know about that. And if that one that you do sort of in that transition to middle school is fine, then maybe you don't need another one until transition to adulthood. But that would be the other time. Like if everything looks good and he's doing great in school, then I would say that's when I would advocate. And then I would also just add the caveat that to think about what is your school district like. I have met kids where they come in and they say everything is fine, and then, depending on what the school resources are in that district, maybe it's not fine, and especially with these other risk factors.
Quick question. You said insurance does cover it?
Mm-hmm. Yes. So.
Well, that's a different thing in terms of there are people in the community who do not take insurance. They don't accept insurance. They're a fee for service. At the hospital, we take insurance. There are some practices in Connecticut, I probably would know of one or two in Massachusetts, depending on where everybody's from, where there are practices that do take insurance. So that's one piece of it. And then if it's a practice that takes insurance, is it covered is a separate question. But they are covered by insurance.
And adding on to this part, at least in our center in Massachusetts, it takes a while to get into a person's office to get this testing done. Depending on where you are, it sounds like you're embedded in the system, so it's probably much easier. But for my clinic, we refer to one of our connected facilities, and it sometimes takes 6, 9, 12 months to actually get an evaluation done in some circumstances. So just talk to your team about what to expect. But I also have it covered for my patients. And then for the other question that was about MRI screening. So since the American Society for Hematology has these recommendations, I haven't had problems getting my patients' MRIs covered. The MRA, sometimes I have more trouble, which is the looking at the blood vessels instead of the brain tissue, which we try to do as a connected study. Sometimes I've had issues getting that part covered compared to just getting the MRI, but I don't think that you should have issues getting a brain evaluation scheduled and booked.
Okay, next question here.
Good morning. My name is Veronica Marion, and my granddaughter, Sky, has sickle cell. She's in first grade. So my question's for Lauren. And it's regarding it's regarding the assessment. So how early, and then where does the referral comes from? Does it come from the pediatrician?
So pediatricians can make referrals or hematologists. So at Connecticut Children's, we're lucky I'm embedded in the team. So Dr. Borokoff or any of our APs can just put the referral in and they come right to me. But if you're at a different center, you can ask, because pediatricians sometimes know of people, but I would start with the hematologist because they might have somebody in the medical system that might be easier to get it while you're talking about the insurance issues before. If you go out into the community, like with a referral by the pediatrician, that might be more likely something that a practice that doesn't take insurance.
And is there a grade, like an age that you recommend?
Well, I always think, so here, the issue I have is that I feel like I meet middle schoolers with sickle cell disease and they're having all these struggles. And we know that middle school developmentally comes with all these struggles. But then the school says, well, it's because they're missing school. That's the only problem. It's because they're missing school. And I think, well, sure, missing school is probably making problems worse, but there was probably things before that where the missing school has just compounded them or made them worse. So if we could get an evaluation earlier and we can show that these weaknesses exist earlier, then when pain crises do become more frequent or they are missing more school, then we can say to the school, no, we have this data. This has existed long before these school absences happened. Because I think that's always the argument, right, is trying to get the school district to do everything that we're asking for. So if there are no concerns and first grade is going well, great, but it's not a bad time to get it, right? Because you're in that window of like, you're learning the basics. If there's any vulnerabilities in those early, like learning to read skills, right? Reading is a really central skill that we need to have to be successful in our society. So it's a time to pick some of that stuff up. But if you don't have concerns, I would say third grade.
Okay. Last question.
Yeah.
So your last bullet says to monitor mental health and
Yep.
get help when needed.
Yep.
Can you give us an example of monitoring mental health for a first grader?
Well, so you know your kids the best, right? So if you notice a change in their behavior, and it's going to look different at different ages. A first grader might be like they're more grumpy or they're more irritable or they're just not their happy-go-lucky self. Then we have to think about what are some of the things that could be, what's going on in their environment? Are there any kinds of things? And when we think about then that 12, 13, 14, are they withdrawing? Are they spending more time in their room? They're not really talking to you. They're not engaging in family activities. Is it, a kid who never really seemed worried, but now all of a sudden they're fearful of things, or they're not willing to do things that they liked to do before, and they seem just more scared or anxious or worried. So all of those kinds of things. And I think it's important to bring those up with any of your providers. So the pediatrician is a great place. A lot of pediatric practices now will actually give questionnaires, but also you can bring it up to your hematologist. It happens all the time and again, we're lucky because we have neuropsychology and pediatric psychology embedded in our center, so we can get patients and families help right within our clinic.